Good afternoon, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined today by Dr. LaQuandra Nesbitt, the director of D.C. Health, Mila Kaufman, the executive director of D.C.'s Health Benefit Exchange, and Chris Rodriguez, the director of DCHCMA. And we're going to provide an update to you from Mila Kaufman, and then we'll go into a more general coronavirus 19 situational update. We have all been paying close attention to the talk this week about the Affordable Care Act. And with open enrollment just around the corner, I wanted DC HealthLink to come in and talk about health insurance and the availability of health insurance in the district. We all know that because of the district's early action on affordable health care in the district and the passage of the Affordable Care Act, Washington, D.C. has the second lowest uninsured rate in the nation. Nearly 97% of D.C. residents are covered. And we've been able to cut the uninsured rate in half since launching DC HealthLink. And today, through the small group of individual markets, 100,000 people are covered by private health insurance. And I know that Mila is going to talk in some detail about how that works. 80,000 employees and dependents are covered by district small businesses and nonprofits. 5,100 district employers are covered, and 11,000 Congress members and designated staff in the district offices on the Hill are also covered. 17,000 residents are covered through the individual markets. I'm so proud of what we have been able to accomplish in the district, and I wanted to turn to Executive Director Kaufman to say more about DC HealthLink.
Thank you, Mayor Bowser, and thank you for your strong advocacy to protect the Affordable Care Act here in the district and make sure that people who live here and work here have all the protections under the Affordable Care Act. Next slide, please. So during the pandemic, we've made it even easier to get health insurance. Anyone who needs health insurance now can enroll. Just go to dchealthlink.com and select COVID-19 as a qualifying event, and your coverage can start immediately. Also, if you're a small business or a nonprofit and can't afford to contribute to your employees' premiums, that's okay. We've waived that requirement. You can still enroll in group health insurance. Also, there are no late fees. There is no interest for premiums being paid late. And we're not terminating anyone's coverage for non-payment of premiums. Next slide, please. Thank you. So we are close to open enrollment. This is our annual open enrollment that will start November 1, and it runs through January 31st. We do have window shopping for DC residents, and window shopping starts tomorrow, October 15th, and runs for 2 weeks through October 31st. So you can check out all of the 2021 health plans, premium rates, and coverage options early. If you are looking for affordable coverage, the great news is that 15 out of the 25 health plans we have for residents, the premiums for 2021 are lower than they are for 2020. If you're looking for a health plan that has no deductibles for primary care, for specialists, for urgent care, for prescription medication, generic prescription medication, for mental and behavioral health visits, if you need a health plan with no deductibles for those services, then please shop our standard plans. All of our standard plans at all levels, bronze, which has the lowest premiums, silver, gold, and platinum standard plans have services covered without deductibles. And if you're looking for a health plan that covers testing, diagnosis, and treatment of COVID-19, The great news is that all of our DC Health Link and all health plans in DC cover those services at no cost to you, no deductibles, no copays, no coinsurance. And that's thanks to our insurance commissioner, Karima Woods, and the emergency order she issued earlier this year. Next slide, please. We have health plans that fit all budgets. For small businesses and nonprofits, we have 163 different health plans for 2021 from United, from Aetna, from Care First Blue Cross Blue Shield, as well as from Kaiser. And for DC residents purchasing their own individual health insurance coverage, we have 25 different health plans from Kaiser and from Care First Blue Cross Blue Shield. Next slide, please. So, get covered and stay covered. To learn more and to enroll, please visit dchealthlink.com. Thank you, Mayor Bowser.
Well, thank you, Mila. I have a feeling you could talk about those plans for a while. We want people to recognize that I had not heard the term window shopping, but that allows DC residents to go to DC Health Link and start to shop the various plans that they will be able to sign up for starting November 1st. Okay, so there you have it, dchealthlink.com. Yes. So now let me just also remind everybody about their flu shot, or perhaps I should ask Dr. Nesbitt to remind everybody about their flu shot.
Sure. So we've been emphasizing the importance of everyone getting their flu shot, everyone 6 months of age and older. And it's been important for us every year during influenza season, having everyone focus on getting those flu shots beginning in September. We want everyone to get those flu shots before Halloween, so getting them before the end of September is increasingly important, especially now that we are in a global pandemic. So we've made opportunities available for people to get their flu shots in the district. We have locations available in DC Monday through Friday at a number of public available locations. These flu shots are free. We do ask that you bring your insurance card and a government-issued ID. No registration is required. We have partnered with both Walgreens and CVS with this opportunity. And Monday through Friday, the locations are available in the morning at F Street, which is co-located with our COVID-19 testing site. And then CVS Pharmacy provides flu shots at 3 Firehouse testing locations around the district on Tuesdays and Thursday afternoons and evenings from 3 p.m. to 7 p.m. So lots of opportunities for people to get their flu shots. If you don't have health insurance, which we know is a very small proportion of our population, given the presentation we've just heard from Director Kaufman, we ask that you visit dchealth.dc.gov/flu to get more information as to the opportunities for flu vaccination for people who are uninsured. So please, everyone, get your flu shot. Help to keep yourself and others around you protected. Thank you.
Thank you, Dr. Nesbitt. And we are also reminding all of our residents that October is Breast Cancer Awareness Month, and that breast cancer is the most diagnosed cancer in DC women. So we want to remind everybody to follow their health care plan and make sure that they're up to date on their screenings for breast cancer. I also want to make you aware of Project WISH, which provides free breast and cervical cancer screenings and diagnostic follow-ups for eligible DC women. And you can learn more about that on the DC Health website as well. I now want to turn to our COVID-19 update, and we will, of course, Dr. Nesbitt will be available to answer any questions that you have about these numbers. This morning, we announced 64 new cases of COVID-19 in our community, and sadly, an additional Washingtonian succumbed to the virus. You can also see the metrics that we report daily, and our team continues to follow them for any necessary action on our part. Today, I've asked Dr. Nesbitt as well to share with the public the most recent exposure data for positive cases through October 8th and to go over that data.
Thank you, Madam Mayor. So we have the opportunity to review through our case interviews, and since we made a very public appeal for people to answer the call when they receive a call from our DC COVID-19 team, our contact trace force, we have noticed increased participation with individuals completing their interviews within 3 days of receiving a call from our team. This allows us to have an understanding of the types of activities that residents in the District of Columbia are participating in or experiencing during their exposure period, which is the 14 days prior to their diagnosis of COVID-19, whether they are symptomatic at the time of their diagnosis or not. We have before you today, we will just be discussing out of the 374 individuals who were interviewed and have provided us additional insight into their exposure-related activities from the time period October 2nd through October 8th. One of the things that we do is we categorize activities based on the potential for exposure. So there's a number of activities that individuals do throughout the course of the day, the course of the week, or the time period that could be of concern to us, where their exposure risk is not as high. And we've talked about what some of those things might be. We've also discussed with you all that close contact is being within 6 feet for at least 15 minutes. Or being exposed to the respiratory secretions of an individual who has been diagnosed with COVID-19. And so there may be activities that someone participates in, such as going outside for a walk and not being exposed to anyone or being in close contact, or having gone to the grocery store and not having sustained or close contact with anyone that would not be at high risk for exposure. So again, it doesn't mean that if someone isn't listed here as having participated in an activity that they were only in their home all by themselves and isolated and diagnosed with COVID-19. It means that they did not participate in any of those activities that we consider to be high to moderate risk for exposure. You'll also note that work and work-related exposures is listed on this list. That doesn't mean that we don't support people being in the workplace. Work is essential. There are some positions that are considered to be critical infrastructure positions or critical to the sustaining of our society. And there are some workplaces that are increasing the number of individuals who have returned to the workplace. That's okay from a public health perspective, because we know that those workplaces can have social distancing, people can be kept 6 feet apart, masks are worn, the proper cleaning and disinfectant practices are in place. Why we classify this as an opportunity for high to moderate exposure or high to moderate activity types is because there is the potential, depending on individual and human behavior, for close contact to occur. And again, that close contact being within 6 feet or for at least 15 minutes, or coming into contact with the infected secretions of a COVID-19 positive individual. So you'll see here in the data that we are demonstrating to you, and this is important because we want to be able to highlight what some of the drivers of the types of activities that individuals are participating in the past week for the cases, and having our community really be able to remain focused on what it is that we can do to keep our rates of COVID-19 low in the District of Columbia, especially as we move into the fall and winter months and the celebration of holidays that we all enjoy. We have individuals who have reported out of the 374 cases, about 17.6% of individuals reporting having traveled. We focus on travel outside of the DMV region. We focus on that type of travel because we know that many residents of the District of Columbia may commute outside of the DMV on a daily basis, for professional reasons or as a means of conducting business or other critical personal activities, including seeking health care. We note that nearly 21% of individuals reported activities, including dining in restaurants. Nearly 22% have work-related activities or potential exposures, and approximately 25% have documented or reported attending a social event. I want to have a little bit of discussion about the social events. We classify social events in terms of activities or events where there were at least 5 or more attendees. Over half of these events, or approximately half of these events, had 5 to 10 attendees reported. And almost 80% had 20 or fewer individuals in attendance. Other observations are around 63% of the social events were reported by the individuals who have tested COVID-19 positive to not consistently adhere with social distancing recommendations, such as keeping 6 feet of distance or wearing a mask. This was regardless as to whether or not the event was hosted indoors or outdoors. So this suggests to us a phenomenon that is happening across the country when we speak with our colleagues in other cities, that people are very comfortable with becoming relaxed when they attend gatherings that are hosted by their friends and family. And suggesting that you are more likely to remove your mask, have casual conversation in close proximity when there is an event that is hosted by a close friend or a relative, backyard gatherings, indoor dining events and opportunities with friends and family, which may be hosted dinners, small birthday parties for children or adults, and other activities where food may even be involved. So these are just some things that we want to have people have top of mind when they are thinking about hosting social events or gatherings, attending social events and gatherings. That is critically important that we continue to adhere to the social distancing guidelines that we have advised. We do have guidelines out for hosting events and hosting gatherings because we recognize that our own social and emotional well-being is critically important during this time, but we want people to still recognize the importance of maintaining social distancing and wearing a mask anytime that you are with people who are not part of your household, even if they are relatives and close friends. We also want people to know that it is safe to be in your workplace, but adhering to all of the structured guidelines that your employer puts forward is the best way to keep yourself safe in your work environment. So even though this is your best work buddy, your best work wife, your best work husband, keeping your mask on and making sure that you wash your hands before you take your lunch, and all of those things are the best way to keep your risk of COVID down in the workplace. And also we have a great team of individuals at DC Health and ABRA who visit our restaurants to ensure that they are complying with the guidelines, but how we as residents comply with those guidelines and keeping our mask on anytime that we are not actively eating, being sure to make reservations ahead of time and not hanging around crowding the foyers are all things that we can do to ensure that those proprietors of those restaurants are keeping you safe while you are in those environments. And then lastly, we need to make wise decisions when we are traveling. We hear often when we are doing a little bit of ground truthing at our testing sites that people go to get a test to make sure that they are COVID-free before they travel. If you're using this strategy and approach, anytime that you get a test, you should get a test and go home and await the results. So getting a test because you plan to travel outside of the region isn't sufficient. You should test, quarantine, and then conduct your activities. So we have individuals who have tested, going about their day, participated in other social activities, having more opportunities for exposure, and then participated in air travel while they were infectious, some knowingly and some unknowingly. And this creates a risk for spread across the country. And when people do this in other jurisdictions, they have the potential to bring cases to the District of Columbia. So these are all things that we can be mindful of to help reduce the spread of COVID-19 in our own community and beyond. So thank you, Madam Mayor.
Thank you. That was a lot to digest, but all very good information that we are gleaning from interviewees in our city. So please take heed. And we continue to focus, and I'll move quickly through the next slides on all the things that we can do as a community to stop the spread of COVID. And part of it, you've heard Dr. Nesbitt say this frequently, is that we should continue to choose our activities wisely and don't succumb to COVID fatigue when we know the things that will keep our community safe. And part of that is, the other way I say it is, you don't have to go just because you were invited, and you know your level of exposure, so keep that in mind when accepting invitations. Don't get tired of protecting yourself or our entire community. Wear a mask, cover your mouth and nose, wear it even when you're at your home and you have visitors to your home. When you're at work, hanging out with friends, and visiting family members who live with you. And I thought I would just share this, and I'm sure that many of us have had this experience, but this is a workplace experience that I thought was kind of instructive of what Dr. Nesbitt was talking about. We can do all of that we can to set up the workplace for distancing and reminders of people to wear masks and all of the things that we will do to make our workplaces safe. But it was one particular Monday that I observed in my workplace, and it was a good Monday because our football team won a game. It's a very good Monday. But what I saw was two folks who work in the same building, and one was visiting the other's workstation to talk about the football game because I overheard the conversation. Well, I approached to go where I was going. And I say that only to mention that that's a common thing. It's a good football game. You want to catch up with your coworkers. But one was leaning over the desk of the other and did not properly have on a mask. And I said to myself, this is what Dr. Nesbitt is talking about when she says we go into the workplace and we can introduce various activities that aren't safe for each other. So it's just a reminder that we're going to set up the workplaces, but we also have to check our own activities and check them very closely. And so we continue to remind people to avoid crowds, to stay 6 feet apart, to practice good hygiene, and do not go to your workplace or anywhere if you are feeling sick. So that's our update for today. Yes, Sam.
For Dr. Nesbitt, how many were those churches? Any of those churches, the social gatherings you were talking about?
So, Sam, that's an excellent question. While the data that you have, and I believe you have the packet, so you'll have that chart, we have seen an increase in people reporting faith-based activities broadly as a category. They ticked up to 6.1%. However, they are not listed in the summary bar charts over to the side. So out of the 374 case interviews that we had, about 23 of those case interviews reported having participated in some faith-based activity. So that could be the weekly service, it could be a dinner or some other activity hosted by the faith institution. It could be a host of things, but it is a faith-related event.
And does this include the White House event?
So to respond specifically to your question, we consider that to be a workplace. So if we were to have any cases related to that, they would be classified as a workplace.
But is it in these numbers, or can you say?
If we were to have any cases, it would be classified as a workplace.
What I'm saying, though, the White House incident, is that included in these numbers?
Any other questions?
Okay.
Thank you.
Yes, Julie.
I have a couple of questions for Dr. Nesbitt. Thank you so much for providing this information. This is very helpful. For the restaurants and for social events, do you have a breakdown of how many of those were indoor versus outdoor?
So I do not have them by each specific activity. So we don't drill down when we are doing an interview to ask the individual if for restaurants specifically, if they were indoor or outdoor. So that's not a focal part of our interviews at this point. What we do for social events, however, is we do ask if they are indoor or outdoor. And that's been pretty consistent from week to week in terms of indoor, outdoor, or a combination of indoor, outdoor. I don't have the exact percentage breakdown right now with me, but I can tell you that our observations over time for those categories have not changed drastically. So we are not yet at a point where we are seeing a huge transition of people attending social events, again, categorized specifically as social events, transitioning completely indoor, or the mix of indoor-outdoor activities shifting. And that is likely because we still have pretty remarkably good weather here that is suitable for outdoor and a mixture of indoor-outdoor activities.
Okay, I hope I can get those percentages from you later in that case, if you are keeping track of that. That sounds useful. Can I also ask about...
Well, I just told you we're not seeing a shift in the trend. Hopefully that's satisfactory.
Right, but what the trend has been, it's not changing, but I don't know if it's 20% or 80%.
Okay.
Was
But
social.
can I also ask, as we look forward to hopefully having a vaccine someday, I know you're putting together a vaccine distribution plan. Can you tell us about that plan, about how you're going to ensure that vulnerable populations get the vaccine, that it's stored and transported, and there's a lot of logistics that go into this?
Sure, great. This is a wonderful question. Our primary goal is to make sure that we have equitable allocation and access to the plan. And we talk a lot about ensuring that there is a balance. What we call a balance is that early on, there is going to be a need to reach the groups who are the most vulnerable in terms of their risk of morbidity and mortality, as well as their exposure to the virus. So balancing that. And we need to ensure that they actually have confidence in the vaccine. So if we have identified them as a priority group, for getting the vaccine when there are limited quantities available, that they actually want to get the vaccine, have confidence in it, and will take it up. As there are more doses of the vaccine available, and this is not specific to the district, right? This is specific to vaccine allocation across the country. As there are more vaccine doses available, then we are able to vaccinate the general public. But early on, we have to balance who we believe should get it from a risk of exposure, a morbidity and mortality perspective, et cetera, are the people who want to have it versus the people who want to have it not necessarily being the highest risk groups from an exposure and a morbidity and a mortality perspective. So a lot of our discussions are aimed around ensuring that there is great vaccine confidence in those groups who are the ones who should be prioritized initially. Both the CDC and the National Academy of Medicine have talked about this phased approach where there is some limited quantities of vaccine available, which is phase 1. Phase 2, there is more vaccine available, and then later on in phase 3, there's still more vaccine available and more distribution points. So a lot of our strategy is thinking through how we will distribute vaccine in all of those phases, how we will ensure that vaccine confidence is high in our community, and how we will be working with all of our strategic partners to achieve those goals and objectives.
Thank you. That's all very useful. So that we can know more about those 2 phases, will you be making the plan that's due Friday available to the public?
As it is a draft and a working document, likely not. But we do have a public discussion process with one of our scientific advisory committees that anyone is able to join, and we make, when those meetings occur, publicly available. Our first deliberations happened last Thursday and are recorded for anyone to view.
Thank you.
Thank you. This is another question for Dr. Nesbitt. Don't mean to keep bothering you, but could you just please expound on just the vaccine confidence? I know that you said that a lot of attention will be placed on that, obviously, because we want to give the vaccine to those who want it. What would that actually look like, tangibly speaking? You were talking about vaccine confidence, trying to educate it, community members so that they would want to take the vaccine. I just want to know, I know the plan, you said it'll be out Friday, but can you give us some detail as to what that actually looks like?
Well, I think Dr. Nesbitt just spent some time talking about how DC Health approaches its planning around it and is working with federal partners in the process, which we are very happy to engage in that discussion. She's already talked about how you build out the plan for in Focus First, where the vaccine is more limited on more vulnerable people and people who are, who would suffer the most from the virus. So that's what we'll continue to do. You also heard Dr. Nesbitt say that she has impaneled a scientific advisory committee, and that committee is made up of local experts, some of whom are doctors and scientists, and others are community members. And that local advisory committee, I don't know what their whole agenda is, but I know that they're going to be getting some of that information first and being able to share it with their neighbors. And that's just another level of how we build, how we will build confidence when we know that the vaccine is safe and reliable and effective. Yes, Mark.
If I could go back to the contact tracing data, which is very much appreciated. I think you said, and I want to make sure I'm correct, that the faith-based activities accounted for, you believe, 6.1%?
Yes.
Okay, and so does that mean, and I appreciate that this graph shows us the top 4, but do you have a graph that shows, that drills down all the way to 6%, what's between that we could see that, the other activities?
Thank you for the question, Mark, and the clarification. So each category is not mutually exclusive, right? So an individual, as the bar chart indicates, could have participated in more than one type of activity. So I do have visibility into each category, to a number of categories that are not exhaustive. And not every type of activity is on a chart, right? So when an interview is conducted, we ask about certain types of activities, and then they are analyzed for trends. So personal care services, faith-based activities are analyzed, social events, restaurant, bars, travel, and work are categories that we have been trending over time. Faith-based activities and personal care services are on the lower end. They've the highest that they've gotten is around the 6% mark, and that's been in the past week. They have not been as high as the 4 that we have here. And we don't trend, for example, gyms and fitness centers, but we know that they have the potential for spread, so they are assessed during the interview process. So hopefully does that help answer your question?
And
Okay.
you somewhat touched on one of my other questions.
Okay.
And that is, when we see workplace accounting for 21.7%, do you know if do you drill down into workplace to determine of that 21.7%, how many of those come from restaurants as the workplace?
So that's a great question. Thank you. So if restaurant is listed, it's more of the patron visiting a restaurant, and it is not someone working in a restaurant.
Okay, so but do you know of the workplace numbers? Like, what is the highest workplace that reports COVID numbers? Is it restaurants? Is it some other? Do you get that drilled down?
So the healthcare facilities are the highest that we see.
That's under workplace.
Yes.
Okay.
Yes, James?
Ms. Kaufman, two questions on DC Health Link. You have here, neither residents nor businesses will have coverage terminated for non-payment. Now, I'm assuming that this is while the public health emergency is in effect. What happens when the public health emergency is no longer applies?
Thank you for that great question. So during the public emergency, as declared by Mayor Bowser, no terminations of coverage for either employers through DC Health Link or individual residents with health insurance through DC Health Link. Once the public emergency ends, then businesses covered through DC Health Link will have 60 days to start paying their premiums. There's a 60-day deferment of premiums. And businesses, that includes nonprofits and for-profits covered through us, will have a whole year to pay back owed premiums. No interest and no late fees. And their coverage will not be terminated.
My second question is, in June 2021, let's say the Supreme Court declares the ACA unconstitutional. Does your office and the Bowser administration have a contingency plan for that?
Okay, so there's no such thing as a contingency plan if the Supreme Court strikes down the Affordable Care Act. Now, Mayor Bowser and DC Council have enacted significant consumer protections that apply to health insurance policies sold here in DC. Now, those protections, unfortunately, can never apply to certain employers who are covered under a federal law called ERISA, which essentially supersedes state protections. So about half of job-based coverage, it would not be protected. In addition, no state prints money, which means if the ACA is struck down, Medicaid expansion, Medicaid is the public health insurance program, where the federal government pays 90 cents to each dollar. So states and we pay 10 cents. Federal government covers 90 cents out of each dollar spent on Medicaid expansion. If that goes away, then we have more than 80,000 residents who are in danger of losing medical care. In addition, if you have private health insurance and the ACA is struck down and you currently receive premium reductions on a monthly basis, all of that goes away. So we've done everything we can do, but we don't print money. And if the Affordable Care Act goes away, millions of Americans will lose their health insurance. And what I think people forget is, even if you have, a COVID-19 test and you test positive, and you don't get sick, but you test positive, you have a pre-existing condition for life. So if the Affordable Care Act isn't there to make sure you have access to affordable quality coverage, you're out of luck. So it's a major, major deal. But we've done everything we could do.
If I could ask other COVID-related questions on unemployment insurance. The district, the 26 weeks for some recipients has expired, has run out of the initial unemployment insurance checks. In DC, it's my understanding that in order to continue with the next 13 weeks, recipients actually have to reapply. And there have been some reports that some people have lost their benefits because they didn't know they had to reapply. I'm wondering if you can, one, tell us how many DC residents fall into that gap that have their initial unemployment, 26 weeks of unemployment have expired, and why the DC doesn't, like other jurisdictions around the country simply automatically extend to the next 13 weeks?
I'm not aware of any gap, Mark, but I'm happy to have Dr. Morris Hughes get back to you with that question.
Council members have written you letters about this, and Dr. Morris actually testified or was asked about this by council. They've given
Well,
you
then the
no
council
update on
has
this?
its answers then.
I'm sorry?
Then the council should have its answers.
Well, I don't know that they do, but I'd kind of like to have the answers.
I'm happy to get back to you. I'm not aware of a gap.
Okay, can I ask about another fiscal matter related to COVID, and that would be the FEMA reimbursements?
Uh-huh.
And I'm wondering where DC is, how much DC has requested in FEMA reimbursements, and how much DC has received. We saw some anecdotal reporting out of Montgomery County that they have experienced, it's been slow to get to them for reimbursements.
Well, I have to tell you, I'm extremely proud of our team who has worked diligently in every way we have planned to not only get services out quickly in an emergency way, but to do so in a way that was most beneficial to our bottom line, and taking and making sure that our expenses recoverable by FEMA were tracked and submitted, and we've been very aggressive about that. So I'm very pleased with where we are, and I'm going to ask Dr. Rodriguez to give you the rundown of those numbers.
Thanks for the question, Mark. And as Mayor Bowser mentioned, since the early months of the pandemic, we've been very aggressive in working with the Office of Contract and Procurement, with the Budget Office under the CA, and with HCMA and my team to submit reimbursements. So to date, we have submitted $153 million to FEMA in eligible expenses for public assistance. And the mayor, very early on in declaring a state of emergency, opened up our eligibility for emergency protective measures. It's called Category B under FEMA's public assistance program. Of the $153 million that we have submitted, 131 has been approved for reimbursement to the District of Columbia by FEMA. The remaining $22 million is still under review from FEMA, and the bottom line that we have received back to the district is $87 million. And so, as the mayor mentioned, and I'm aware, and I spoke with Montgomery County this morning, and I think a lot of what they're seeing, and of course we here in the district are seeing, is FEMA beginning to change some of the guidelines for eligibility. And so we want to make sure that we are continue to be very aggressive in submitting those reimbursements to FEMA.
Okay, yes. Julie.
Can I follow up on that? Good question. Will this vaccine distribution plan require additional federal funding to carry out?
Where are we with the budget on? I think that's part of DOH's.
Yeah.
Yep, go ahead.
So, as you know, the submission on Friday is a draft plan. And part of the reason why it's a draft plan is because the federal government is still working through some of the financing infrastructure for the distribution. They have committed to providing a certain amount of supplies through the distributor for the vaccine, as well as ensuring that there will be no cost for vaccination for any American who chooses to be vaccinated, is how we have been advised. That aside, there are still different elements of the distribution and allocation part at the federal level that are still that still needs to be operationalized because the vaccines themselves have not been approved, right? So depending on which vaccines are approved, what the storage requirements are, what the distribution chain looks like, will have to all be finalized before the true cost of distribution and allocation can be realized. And what those costs look like and who bears those costs can only be finalized at that point.
Okay, thank you. Mayor Bowser, can I also ask one more question and then I'm done? The Washington Teachers Union has put out their requests for reopening schools. Do you think that their demands are reasonable?
What request are you
They
talking
have
about?
a sort of a list of criteria for reopening schools.
I think that the Washington Teachers Union and DC Public Schools have had very fruitful conversations over all of last week and over the weekend. And I think there's large agreement between the WTU and DC Public Schools about how to reopen. Yes.
If I could, on just one follow-up to what I think I heard you say, but I wanted to ask Dr. Nesbitt for her reaction. I believe you said if ACA went down, there would be 80,000 DC residents who would lose coverage. Was that the correct number?
More than 80,000 childless adults are covered through Medicaid expansion. In addition, several thousand rely on premium reductions through premium tax credits. And one thing I forgot to mention is we've done some actuarial analysis, and if people who live in other states without consumer protections, even if 800 of them who are sick who moved to DC, we're looking at least 25% increases in premiums, so thousands more would be at risk of losing health insurance, private health insurance, because of affordability.
And so, Dr. Nesbitt, I guess what I'd like from you on this is, at a time when we're, fighting COVID, looking at flu season and the possibility of this happening, although this may not happen for some time, what would that do to the district's healthcare system? What pressures would that put, if any, on the district's healthcare system?
Well, Mark, there's a couple of things that I think we have to be conscious of and aware of. And, the one of the things that I have always been tremendously proud of working in and out of the district for the past 10 years are the decisions that we have made as a community to ensure that our residents have been insured, right? Prior to ACA, we were a community that had a high insurance rate. What I think people miss that the passage of the ACA did was it allowed us to really take full advantage of Medicaid expansion and allow us to invest the dollars that we were spending because we had a compassionate commitment to ensuring our jurisdiction, doing other things. So expanding the benefits that people had, investing in other things that have now allow us to build a new hospital east of the river, to enter into a partnership to ensure that Howard University now has the hospital, that it can build a new hospital and expand to build a clinically integrated network, right? So all of these things, if we have to ensure that our residents can remain insured, keep that insurance level up at 97% by investing and paying for their health insurance so they can still go to the doctor, still have their coverage, are we now going to have to compromise some of the other advances in healthcare access that we've had to invest in? I mean, that would be devastating to us to have to make those types of decisions, to choose between this or that, when all of them are critically important to ensuring that we have a healthy community and a healthy society. I mean, these are the types of tough decisions that we're going to have to force people to make. And that is completely unfair and unconscionable to be making those types of decisions in the 2020s, right? I think that's the types of things that people are not realizing.
Mayor Bowser, if I could ask you one off-topic question. I'm sure you have been following what's happened with the governor of Michigan, and now reports that Governor Northam in Virginia was also a target of this domestic terrorist plot. I'm just wondering, were you notified by the FBI or anybody about this going on? And I know you don't like to talk about your security protocol, but does this raise your level of concern for your personal safety? And has any steps been taken that you can tell us about, given your high profile in the country as we move forward?
Thank you, Mark, for that question. And let me just say for Governor Whitmer and Governor Northam that I feel very sorry that they're having that experience, that they're elected officials to lead. And we all know in these positions, sometimes people aren't happy with your decisions, but people who have been duly elected have to make tough decisions sometimes, and their lives shouldn't be put in danger because of that. And so I feel very grateful to the law enforcement officials who worked on that case. And I hope that people take it very seriously because it is very serious. Elected officials shouldn't be terrorized for doing their jobs. And so I was not given a report. That's not to say that Chief Newsham wasn't, and he may have been, I'm not sure about that. But we don't see any, I don't see, and I will say this much, any connection to me. Yes.
Mayor, I'm interested in this employment story as well. First off, I'm curious, you know, the folks lost the $600 in DC. Have they started getting?
Nobody lost anything in DC. The $600 was not renewed by the federal government.
Right, okay. If you're not they're not getting the money, right?
You suggested that they lost
I'm not
it in
suggesting
DC.
They just lost it.
Well,
I didn't
that's
say
what
who
you
took
said.
it. But in any event, what about the 300? Are the people here getting that now?
Yes, they are.
They are getting the 300? Okay. Mike, and another thing that you know, of course, we're hearing from the chairman of the Labor Committee of the DC Council, who says she is concerned that DC residents are not being told about changes that they need to make in order to continue to get the best benefits. And among those, Uber drivers and consultants, apparently they got a cut as well because of the $600 when that was cut. And they have not been let's say, sustained. And so some of them are getting $179 a week. So she's saying basically if the city told folks, they would be getting a lot more. Are you following all of this?
It's hard for me to follow your question, Sam, and it's just because I'm not familiar with all of those different numbers. I just don't know them off the top of my head.
That basically you're satisfied that employment services is providing people with adequate information so that people who are out of work can get the benefits that they are entitled to.
I will be happy to look into your question and respond to you. I can't tell you off the top of my head about those specific questions. Okay, thank you, everybody.